Good morning. Good morning, everyone. My name is Nelson Lee, Director of Institute of Pandemics. On behalf of the organizing and the steering committee, I welcome everybody to the Institute's 2025 Interdisciplinary Symposium. I'm very pleased to share with you that today we've got over 220 people registered for this in-person symposium, with another 170 joining us online. Before we begin, I wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron, Wendat, the Seneca, and the Mississaugas of the French. Today, this meeting place is still the home to many indigenous people from across Turtle Island, and we're grateful to have the opportunity to work with them. Just let me say a few words about the Institute. The Institute for Pandemics was established during the COVID-19 pandemic that addresses multidimensional, complex public health challenges, which have then become University of Toronto's Institutional Strategic Initiative, ISI, in late 2022. Since our launch, we have built a membership of over 200 researchers from 12 academic divisions across all our 3 campuses and globally. In addition to public health, epidemiology, and health policy, we combine expertise from medicine, social sciences, business and management, pharmacy, engineering, computer sciences, and artificial intelligence, among numerous other disciplines. Centering on readiness, resilience, recovery, and cross-cutting equity, our goals are to power interdisciplinary research, strengthen our health system resilience and preparedness, inform critical public health policies, counter misinformation, and to equip our future health leaders with a broad insight necessary for effective response. Since our last symposium in 2024, we completed the second calculus and research development program and supported interdisciplinary research teams to initiate their high-impact projects from health system resilience, disinformation, data response, AI and legal healthcare, supply shortages, health inequities, and mental health challenges, public health crisis, and many others. Together with the phase 1 program, IfP has launched over 32 new projects, which you can actually find the details in the digital program using the QR code. Our graduate studentship programs as of today have supported 15 students who are co-supervised by faculty members from different disciplines for their works on wastewater surveillance, drug shortages, avian influenza, respiratory protection, remote learning. Some of these will be presented later. IfP's training program has engaged over 220 graduate students across divisions to broaden their skills and pandemic and preparedness focused research. And in the past 2 years, we have held over 20 webinars and public events that have engaged over 3,500 attendees. And we have recently launched a new knowledge mobilization program to support engagement of knowledge users, stakeholders, and decision makers to impact the policy. So coming back to our event today, the theme of this year's symposium is responding to the unexpected, bridging science, policy, and community actions. This audience will probably agree with me that the world is currently experiencing pandemic activity. And despite we are still grappling with the broader impact and aftermath of COVID-19 and waves of variant resurgence, and that new public health threats continues to emerge, such as avian influenza, H5N1, Mpox, climate-sensitive diseases. They continue to come, and there could be threats that are accidental or deliberate in nature, biological or non-biological. We know that these public health emergencies will continue to challenge our health, our systems, and our society, causing unexpected, widespread disruption and suffering. We know that they will come, just not exactly sure when. The science and the scientific and public health communities are continuing and spearheading preparedness efforts to respond to the unexpected. And as for COVID-19, this will require cross-discipline, cross-sector collaboration. And that's the reason why we're gathering here today to share our knowledge efforts. IfP is an interdisciplinary platform with its diverse expertise and adaptive research method and framework has the vision to lead some of these dialogues to tackle public health emergencies of various forms beyond COVID-19. So today, we're going to hear from our distinguished speakers and leading experts in the field to discuss preparing for the next health crisis, learnings from the Rotman Report and beyond by Dr. Stephen Lucas, former Deputy Minister of Health Canada, now CEO of MyTech, together with Drs. Fahad Rasa, Helen Angus, Linda Bill, and our Dean at the Stone. And also in the morning, we'll hear about the economic impacts of pandemics and public health emergencies. Are we ready and resilient? By Roselle Martino, Executive VP, Toronto Board of Trade, together with Professors Audrey Laporte, Jeff Anderson, and Paul Birkenholtz. And after lunch, strengthening health securities, strategies and innovations by Dr. Amash Hidalgo from Johns Hopkins Center for Health Security, together with Dr. Michelle Murphy, Professor David Guzman, and Big Martin. And the closing keynote, pandemic preparedness and response, strategies for future pandemics by Dr. Teresa Tan, Chief Public Health Officer, Public Health Agency of Canada, to help us chart the course going forward. I'm hopeful this symposium will provide valuable opportunities for reflection, discussion, interaction, and collaboration among our participants from diverse backgrounds and sectors. I look forward to witnessing the dynamic discussion and knowledge sharing that will take place at our 2025 Interdisciplinary Symposium. Thank you very much. Here I will introduce the Professor Christofferson, Dean of Rotman School of Management, a contributing faculty to the Institute, to give the welcome remark. And on behalf of IfP, I would like to thank Rotman for the commitment and support in the past years, and has graciously provided the venue for the program. Professor.
Good morning, everyone, and welcome. It's really wonderful for you to be here. I'm going to be very short, but you might wonder, why are you sitting in a management school for a symposium like this? And I just honestly couldn't think of anything better. Here, people sitting in this room have a shared commitment to understanding, preparing for, and responding to public health crises. But this is not just a health issue. This is an economic issue. This is a management issue. There's so many aspects to it. And I love the name of this, interdisciplinary, the ability for us to work together across different disciplines. And it's something that certainly as a School of Management, we see a role for us to sort of contribute to. And so it's with great pride that, we have a chance to contribute to this. There's complex challenges, something that Rotman really tries to sort of step up for, whether it's business, society, public health, and the area of interdisciplinary collaboration is very strong within the Institute, led by our public health group here. So COVID-19 underscored the critical role of strong leadership. I see people in the room, Dr. Teresa Tam, it's someone I've seen on the news many, many times. Takes strong leadership, resilient healthcare systems, strategic decision-making, and not just within the medical community, but across sectors, including businesses. How do you coordinate? How do you communicate? The importance, the areas of policy and technology. And I'm really proud to say that we're hosting this symposium here at the Rotman School, which brings together distinguished experts from public health, government, business, and academia to explore lessons learned from past crises, and hopefully help us be more preventative in thinking about how to prevent them. So I really encourage all of you to actively engage in discussions, challenge your assumptions, seek solutions that will prepare for the next crisis, because as history has shown, it is not a question of if, but when that is going to happen. I got completely scared talking to some of the speakers last night about the possibilities and really appreciate as someone that's sort of not fully aware of the work that's being done of what to do to sort of help prevent that nice crisis or enable us to prepare for failure. So thank you so much for being here. I really look forward to the insightful and impactful discussion that's going to happen. And I'm going to pass it back to Nelson. Thanks so much.